Okay, now that we've talked about the voluntary life insurance benefits, you have a second option called a voluntary dental plan that you'll have the ability to enroll in only during this time of open enrollment. It's an excellent plan through the Guardian, and it's what's called a PPO plan, which stands for Preferred Provider Organization. The name of the provider network is called the Dental Guard Preferred. What a PPO simply means is that your benefits are better if you use a network doctor than if you use a dentist that's not part of the network. And we'll explain what we mean. As you can see at the top of the page, these are your bi-monthly rates. It is only $13.23 for an employee only to enroll in the dental program. Again, this deduction comes out bi-monthly, even though you may have 3 paychecks in a given month. That's one of the nice features that the people at Carthage have for their employees, that there's only 2 deductions per month. To add a spouse, your deduction would go up to $26.81. For you and a child or children, it's the same rate. So you can have 1 child, 3, 10, it'll still be the $34.88 to add them. And for a full family, it's $48.86 per month. Now what you'll see is that the way the program works is that there is a $50 deductible, and there's before your benefits would start. Okay? There's 3 deductibles per family for both in-network and out-of-network. However, the nice thing that we've set up is that that deductible of $50 is waived for your preventive services. If you look into the next section, okay, they've listed how your benefits are covered. Your preventive services are covered at 100%, and that would be for your teeth cleanings, fluoride treatments up to age 19 for kids, as well as 1 x-ray per year. If the dentist at that time notices that you have a cavity, once you've paid your $50 deductible, then those basic services would be covered at 80%. And if the doctor finds something a little bit more extensive, like you need a bridge or a crown, once you've met that $50 deductible, then Guardian will pay 50% of those costs going forward. And if you have children, there is an orthodontic benefit at 50% after your deductible as well. There is an annual maximum for the year expenses, and that is $1,000 for both in and out of network. Now, one of the things is that you see on this page is that your in-network and your out-of-network benefits may look the same. However, your out-of-network benefits may require you to pay an additional fee. In-network, Guardian has already negotiated the rates and the benefits, and so they know exactly what they have to pay, so those percentages of your bill are going to hold true. However, outside the network, they haven't negotiated the rates with those dentists. So what Guardian has to do is they have to determine what is a fair price for them to reimburse on. What Guardian does is that they will reimburse your out-of-network expenses based on what's called 90% of usual and customary. To give you an example, let's say you need to have a filling. Well, they will sample the area. If they determine that the average cost is $100, Guardian will use $90 as a benchmark for their reimbursement. So at the 80% level, they'll pay 80% of the $90 versus 80% of the $100. So you may be left with an additional cost. However, you still have a benefit. Now, one of the nice things that Guardian does is they have what's called a rollover benefit. Okay? That $1,000 annual maximum, which will reset itself on January 1st of every year, can be increased. And all you have to do is see the dentist 1 time per year. What happens is that if you see the dentist, okay, that's going to trigger an expense. And every year what Guardian will do is they'll subtract your expenses as long as they're under $500. And so if you see the dentist twice, for example, and have $250 of expenses, they will subtract those expenses from $500. And next year, the following year on January 1st, they will add $250 to that $1,000 going forward. So it's a nice benefit. They will increase that $1,000 up a maximum of $350 the following year if your expenses are not over $150. If you go outside the network, the maximum that they'll add to your plan is $250. Now, one of the things I do want to point out for those of you that are adding kids to the plan, there is a lifetime benefit of $1,000 for the orthodontics. This is standard amongst all the companies out there. Now, this program, you can have your kids on the plan if they don't have to be in school up to age 26. And if they happen to have spent any time in the military, we can continue the plan up to age 30 going forward. Now, if you go to the next page, we're going to talk about is page 17 in your booklets. You will see an expanded view of some of the more common services and how are they covered. As you can see, your preventive services are covered at 100%. Your fillings, your basic services at 80%, and then there's a long list of services that are covered at 50%. One of the things that you can do if you are going to have a service that's not listed on this page, Guardian can put together a predetermination letter for your dentist, and they will outline all the costs. So if you don't see it up here today, there's a way to get that exact number before you have the procedure done. Going to the next page, page 19 in your booklet, this is a full example of how the maximum rollover works. So if you have any questions on this, the only thing that you really need to remember is that you need to see the dentist at least once per year, and then the following year, your $1,000 benefit may be higher, which is a great thing. If you go to the next page, in your booklet, the biggest question once you decide to enroll in the plan is to figure out, okay, is my dentist involved with the Guardian Network or not? And the way that you would do that is you would go online and go to www.guardianlife.com. In the middle of the page on the right-hand side, you will find a button called Find a Provider. Click on that button. You're going to go to Find a Dentist. And then you're going to go underneath the Dental Guard Preferred Network and put in your information, where you live, and a number of dentists hopefully will pop up in your area. If you find that your dentist is not in the area, please get a hold of the HR department with that dentist information, and we will have Guardian contact that office to try and get them involved. Guardian also has an 800 number, which you'll find on your card, so if you can't get to the internet, you can always call them on their 800 line, and they'll be happy to pull up the PPO dentist as well, and our office is always available if you can't find that number. Now let's take a moment before we move on to the vision and what's called a new benefit called the Employee Assistance Program.